Learn everything there is to know about enteric fever in this video. Typhoid fever or enteric fever is a multi-systemic bacterial infection produced primarily by Salmonella enterica serotype typhi and to lesser extent Salmonella serotypes paratyphoid A, B, and C. Salmonella bacteria can bring on infections of the gastrointestinal tract. Typhoid is the most dangerous of them. The germs that cause Salmonella food poisoning have ties to Salmonella typhi. The typhoid bacterium is very contagious. A person who is infected can expel the germs from their body through their feces or, less frequently, through their urine. Someone else could contract typhoid fever if they consume food or drink water that has been contaminated with a tiny bit of feces or pee that has been exposed to bacteria. In regions of the world with poor sanitation and insufficient access to clean water, typhoid fever is most prevalent. Typhoid fever is thought to be more common in children around the world. They may still have building immune systems, which could explain this. However, compared to adults, children with typhoid fever typically exhibit milder symptoms. What about the means through which typhoid illness is spread? Oral transmission and hand-to-mouth transmission are the two methods of transmission. Oral transmission happens when food or drink handled by a carrier comes into contact with sewage-contaminated water, shellfish, or food. Inadequate hand hygiene and using a contaminated lavatory can contribute to hand-to-mouth transmission. What are the signs and symptoms of typhoid and paratyphoid fever? The patient typically has a persistent fever, which may reach a temperature of 39 to 40 degrees. An ongoing fever is referred to as a persistent fever. Other signs and symptoms include nausea, vomiting, loss of appetite, headache, muscle pain, stomach pain, skin rash, diarrhea, or constipation. Consult a doctor right away if you are feeling extremely ill and have a fever. Testing a sample of blood or stool for Salmonella typhi and paratyphi is the only method to be certain. What are the stages of typhoid fever? Typhoid fever symptoms might appear gradually over 4 phases. Antibiotics can prevent you from moving on to subsequent stages if you receive therapy early. Within 5 to 14 days of coming into contact with Salmonella typhi, stage 1 begins. A fever that rises over a few days is the primary symptom. At this point, the bacteria are transferred into your blood. Around the second week of a fever, stage 2 begins, during which the bacteria start to multiply in your Peyer's patches, a region of your immune system that helps you recognize dangerous invaders. Abdominal pain and other symptoms related to the stomach will start to appear. You could develop rose patches that resemble a rash. Stage 3 will often begin during the 3rd week, after your symptoms begin if the patient is not given antibiotic treatment. Some patients get severe complications such as encephalitis, intestinal hemorrhage, pneumonia, and pancreatitis. Most people start to feel better in stage 4. Your high fever starts to subside. Even when you feel better, you may still be contagious because the Salmonella typhi can persist in your gallbladder without causing symptoms. How are typhoid and paratyphoid fevers diagnosed? Samples of blood, feces, or urine can typically be used to confirm a diagnosis. The Salmonella typhi and paratyphi that cause the disorder will be looked for under a microscope on these. The bacteria are not always detected the first time, so you may need to have a series of tests. A Vidal test is an advanced way to check for antibodies that your body makes against the Salmonella bacteria that cause typhoid fever. What is the typhoid fever treatment? Typhoid fever is treated with antibiotics. If you are severely ill or have complications, you will probably need to be admitted to the hospital. Antibiotics used for treatment of typhoid fever include ciprofloxacin, ceftriaxone, cefotaxime, or cefoxiam and azithromycin. Sometimes Salmonella typhi can acquire drug resistance. This means that antibiotics are no longer effective in killing them. This is one of the main reasons why typhoid vaccination is so crucial. If you receive prompt antibiotic treatment, you should begin to feel better within a few days. A week to 10 days may pass before you feel fully recovered. How can I lower my chance of contracting typhoid fever? Getting vaccinated is the best strategy to lower your chance of contracting typhoid fever if you reside in or are visiting a region where it is widespread. Typhoid can be prevented from spreading by washing your hands frequently and handling food safely. A few patients who recover from typhoid fever even after receiving antibiotic treatment still carry the bacterium in their systems. They are referred to as chronic carriers. Despite no longer exhibiting sickness symptoms, people continue to spread the germs by passing it around in their feces. In the end, if you liked this video, do not forget to subscribe to the channel and activate the bell button to receive all new updates. Goodbye.